Hello guys and welcome back to the channel. So in today's video we're going to be discussing these personal insight and motivation questions. My name is Joyel, I'm a fourth year medical student at the University of Cambridge and I was in your position not that long ago. And in this video I talk you guys through the three key areas when it comes to these questions, how best to deal with them, and the potential advantages of having prepared an answer beforehand so you have some kind of structure to attempt your question before you even walk into the interview. So the idea behind these questions, let's first of all have a think about this. So personal insight and motivation questions are very common, and often when you get asked to interview, when you get an interview offer, sometimes in the email they might say that you might have 5 stations, and sometimes they might detail what each of the stations are, and often it's quite common to find a personal insight and motivation question. And so first of all, let's have a breakdown. What does that actually mean? So personal insight is to do with the person that you are, okay? So what is it about you that appeals, what is it about you that appeals to medicine, and what is it that medicine appeals to you about, right? So it can work both ways. And so the second part about it is understanding what medicine actually entails. So the personal insight we already covered. So what is it about medicine that you like? And secondly, what is medicine actually like? So do you have a proper understanding? Do you properly understand what it is like to be a doctor, what it means, the challenges, the hardships? Do you have the appropriate kind of experience? So in previous videos, we talked about volunteering and work experience. And I mentioned that one of the key ideas of work experience was so that you guys could get an understanding of what it is to actually work as a doctor in that kind of environment and in that kind of setting, you know, talking to patients, and if you could actually imagine yourselves there. And like I said, you know, don't be too deterred if you go and do your work experience and it's really challenging and, you know, the doctors ignore you a little bit and it just seems a bit hectic. Like, you will get there, trust me. That's exactly how I felt when I was applying in year 12 and year 13. But there were some aspects about it that I really enjoyed. And even if there is one thing that you really enjoy, I think that's more than enough for you to realize, actually, you know what, you do have what it takes to survive in that kind of environment. Because like I said, when I was in year 12 and year 13, I went on my work experience, you know, there were things that I just thought, oh my days, this just looks too hectic for me. But there were things that I really enjoyed. I really enjoyed, you know, speaking to the patient, seeing how much impact you can have just with a simple conversation or bringing them a coffee, etc., etc. And now here I am 4 years later, so I just started my clinical placement this year, and honestly I'm finding the wards really, really enjoyable, and it's been genuinely so fun to be on. And I wouldn't have really imagined myself saying that perhaps when I was in year 12 and 13, but this is what I mean, right? So as long as there are some positives that you can take away from it, and it's those same positives that I found, you know, all those years ago that I'm still really enjoying, being actually able to, you know, speak to patients, performing examinations, doing practical skills, all of that kind of thing. Okay, so that's important. And so first of all, we've covered why personal insight and motivation questions are asked and what the theory behind them is. So the idea is to make sure that you are a good fit for medicine and that you actually understand what medicine entails and what it is about. So like I mentioned, personal insight and motivation, there's two kind of key areas, but if we were to further divide it, I think you can divide it into roughly 3 key sections, okay? So the first one is to do with kind of like motivation for medicine and for that specific course. So the kind of questions that can come under this are things like, you know, why do you want to be a doctor? Why do you not want to be a nurse? What is it about medicine that interests you? What is it about medicine that disinterests you, perhaps? So, because sometimes they like to throw in the odd negative question in there, and the idea behind that is to really make sure that you've understood perhaps some of the challenges and those other kind of potential negatives to medicine as such. Okay, so remember, it's not always necessarily going to be only positive questions that they give you, and sometimes those kind of negative questions are important because they should also help you think as well, right? Are you sure medicine is really for you? So when you're preparing these questions, ask yourself this, you know, do you think you'll be able to cope with some of the potential pressures? Do you think you'll be able to cope with some of the potential stresses? And remember, the idea isn't to be a perfect doctor age 17 or 18, that isn't what it is, but it's about, okay, are you willing to work hard to be able to potentially overcome it? That's what's really important, okay? So that's the first thing. So the idea there is understanding that you've done your research about what medicine entails. So the first part is motivation for medicine and for that specific course. And sometimes they might even throw in potentially the uni in there as well. So as an extension of this question, they might ask, so why is it? So first of all, they might ask you, you know, why are you fit for medicine? And then they might ask, so why is it that here at blank, medicine would be the best place for you to do it, right? If you get what I mean. So why is it that the University of blank is the best place for you to study medicine? What do you like about our course specifically? So that not only requires an understanding of the medicine course and what it entails, but specifically what is it? So do they have clinical contact early on? Do they have clinical contact later? Do they allow for opportunities such as intercalation, etc., etc.? Okay, so the second point of this is the personal insight. So the personal insight and reflection. So the thing is that these questions are things like, what are your biggest strengths and weaknesses? So tell me about a time where you face challenges. So what kind of person are you when it comes to dealing with blank? How do you deal effectively with stress, etc., etc.? And the idea here is to be honest, right? So please don't paint the image that you're someone who is perfect, because it just immediately comes off as really, really kind of vain. And also it comes off as completely like non-transparent and like dishonest, basically, because they know that it's completely normal for 17-18-year-olds. Even I'm sure there are doctors who have been practicing for decades who still sometimes struggle with potentially communication, who might get nervous in front of a patient, who might etc., 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 right? So the point is, it's not about being perfect, it's about acknowledging your weaknesses. And so one of the things, one of the quotes that I like to think about is in Harry Potter. It's said that help will always be given at Hogwarts to those who ask for it. So the idea behind that is, interviewers want to see that you're honest, that you're able to acknowledge your weaknesses, because that's the only real way that you can move on from something. When you're dealing with kind of tough situations, one of the most important things is to acknowledge, okay, maybe, maybe I'm not as good at this, or maybe I'm not as good at that, and then be able to work on it. But of course, you can't really work on something until you acknowledge that that is potentially a weakness. So, it's important to think about some of your weaknesses. The other thing I'd say is don't overplay it as well. So obviously, you want to still remain as a good candidate. So don't just be like, I'm lazy, I have no time management, I don't work hard at all, I have no dedication, I don't really like medicine. Obviously, don't go that side of things either. There's a fine line to strike. So think about one or two potential things that if they asked you that kind of question, that you'd be able to talk about. And also, when you're doing that as well, I think it's important to offer a remedy. Okay, so don't just be like, I find it quite difficult to manage my time effectively. I often find that I have way more tasks than the time I have available to complete them, and as a result, I often end up missing deadlines. Okay, but incorporate a solution in there, incorporate a remedy in there. So it might be something as simple as, so this is something that I found to be quite challenging, because I like to try and do as much as I possibly can. And so recently I found that my time management skills haven't been as effective as I would like them to be. And I found that often I end up having to postpone tasks, or that I often can't complete all of my tasks on time. However, I have reflected upon this, and one of the things that I found to be really helpful in trying to overcome this is that I've tried to make sure that every single task or activity that I have goes into my calendar, and I try and look at the tasks that I have for the next 2-3 days upcoming, and I always try to prioritize those and try and save the tasks that are furthest away for another time. Okay, something as simple as that. So that's one potential example. The only thing I'd say is that everyone does use the time management example. Everyone uses the time management example. And the other one that everyone uses, which I really hate, is the perfectionist idea. People are like, oh, I'm always, I'm such a perfectionist. I really, I find myself putting too much time into things. And I just think it sounds so cliche. And also it does sound a bit kind of bad, in the sense that, obviously as a doctor, you always want to be giving your all to the patient, right? So in that case, it's okay in a way to be a perfectionist, but then you're like, actually, you know what? I don't want to be a perfectionist. I want to give a little bit less than 100%, which, like I said, doesn't really make sense to me. So yeah, please try to avoid using those. Think of some other ones. And if you can't, then the time management one isn't dreadful, but remember, the more niche your answer is, the more that it sticks out, and the more impressed that the interviewer will be with you. And then finally, the last kind of part of it is kind of your fit for medicine and future orientation as well, okay? So kind of like where do you see yourself in 10 years? Where do you see yourself this many parts down the line? What kind of can you envision yourself doing, whether that be research and clinical, kind of like clinical practice, or just clinical practice, or just research, or academia in terms of like more teaching side of things, etc., etc. There's a wide range of things. The other thing that's really important, I would say, to know as well, is it's important to know the pathway for doctors, in the sense that it's probably really important to understand, okay, so what does it mean to go from a medical student to a consultant, right? So a consultant is the top level, medical student is right bottom of the barrel. So what about everything else in between? So having a good understanding of that pathway is really, really important, and that's something that I'll probably release a video on in the not too far future. But I think that's really important because it shows actually, you know what, this person knows what they're heading towards. They are so interested in this topic area that they've gone out their way to do this research. And it might sound like something that's very minute, but to be honest, I didn't really have an idea. This is perhaps one of the things I should have had a look at. Obviously, I knew consultant was the top, and obviously medical student, foundation years, and I'd heard of these other terms that were thrown around, right? SHO, registrar, etc., but I didn't really know what they were. But yes, that's one thing that I think is really, really important to know. And so the idea here is it's about, okay, so this person is committed enough that obviously they are thinking ahead to the future. Okay, and then here they might ask you some specific qualities about, like, okay, what is it about you that specifically makes you a good doctor? And I know I talked a little bit about this in the first point that I mentioned, but here you could talk about some of your kind of better skills, qualities and attributes here, and try and link it to some of the things that you've done potentially. Okay, so with those kind of like 3 key areas, you can cover pretty much personal insight and motivation. So the first one is kind of your motivation, for instance. So why do you want to do medicine? The second one is about, reflecting on yourself. So personal insight and reflection. So, what do you find difficult? What do you find challenging? What are some of your strengths? What are some of your weaknesses? And the third one is, so why are you a fit for medicine? So what qualities do you have that will make you a good doctor? And what do you know about the future pathway, right? Because that's what you're eventually going to become. You're going to become a doctor, and then you're going to move up another level, and so on and so on and so on and so on. Okay, so yeah, really, really important to consider these ideas, I would say. And so that pretty much brings us to the conclusion of these main kind of areas in terms of these personal insight and motivation questions. The other thing that I would say as well is, so sometimes this can be quite helpful, is there's sometimes quite good to have some kind of framework to your answers. And so a really quick framework that you can use here is something that I call the 3 Ps, basically. So the 3 Ps are very, very simple. Just point, proof, progress. So the idea is you make your point very clear. So one of the things that can happen when people talk is that you can often ramble for quite a bit and not actually get your points across. So if you get asked a question like, what is your biggest strength or what is your biggest weakness? You can just, say the point specifically. So you could say, one of my biggest strengths is staying calm under pressure. You've made your point. Then the next bit is proof. So as it says, what you're trying to do is show examples. So how do you know that you're good at staying calm under pressure? How have you developed the skill? As captain of my school hockey team, as part of the CCF cadets, and you can think of many other different examples, places where you've been in a high pressure situation. Remember, the other thing is you're not trying to bore them. You're not trying to make a list of every single time you've ever dealt well under pressure. Pick 1 or 2, 3 examples and maybe expand upon them a little bit more. Because saying that I'm good at dealing with pressure because I am captain of my school's hockey team is fine, but if you give a little bit more detail and you say, so as part of my school's hockey team, I have to make sure that every week the squads are selected fairly, that people get opportunities, but also at the same time try and maximize, my team's chances of winnings. So it might mean that at certain times in the game that I have to make high pressure decisions, whether to substitute someone on or off, etc., etc. But that's just one example I made up off the top of my head. You can definitely come up with way better than that. Okay, so you can see just by giving a little bit more of an expansion, your answer will already seem like you've thought about it a little bit more, as opposed to just stopping it at a superficial level. Okay, and then finally, progress. So this can be quite good because what it will allow you to do is it will allow you to talk about, okay, how have you developed? So you can say, by doing this, I've learned that, okay? Because the question was asking about what's one of your biggest strengths, and you said one of your biggest strengths was staying calm under pressure. So obviously you've learned to stay calm under pressure, but what else have you learned? So sometimes you might learn that it's important to make a decision and stick with it. Sometimes you might learn that as a leader, that not everyone might agree with your decision, but sometimes, there will always be a couple of people who are against it. But if you believe in it, that's what's important, okay? And like I said, you might disagree with the things that I'm saying here. I'm just trying to create examples off the top of my head. That's all it is. It's not necessarily like you have to listen to what I'm saying, but I'm just giving you the idea of this kind of 3P framework. That's all, okay? And it's going to be quite useful here, and it can hopefully prevent you from rambling on too much as well. That's what's really important. So try having a go yourself, see if you can answer some of these questions with that kind of idea. So let's do a mock question now together. So let's take that, what is one of your biggest weaknesses kind of question. And so if I was answering this, I'm going to talk about being reluctant to ask for help. So this is how I would answer it. So that's an interesting question, and this is something that I've reflected upon. And upon reflection, I've realized that often I find myself reluctant to ask for help. So I've made my point quite succinctly there. So I'm reluctant to ask for help. Now I'm going to move on to my proof. So now you can talk about a potential scenario. So you can say, so one time at school, as part of my school's prefect team, I was enlisted to carry out certain kind of activities in order to help for a potential school's parents' evening. However, I found myself having to be in two places at one time, and instead of trying to ask for help and delegate that role to someone else who was free at the time, I tried to rush around and make it to both places. However, that wasn't successful, and as a result, I kind of ended up half-heartedly doing two jobs at the same time, which wasn't very effective. So proof, I've shown something. And then I can talk about potential progress. So here now I can say, okay, so in order to kind of combat issues like this, one thing that I found to be quite helpful is using potential strategies, such as, setting clear limits and making sure that I'm never double booked for anything, and planning my time so that I'm able to use it effectively and that I don't have to, juggle it between two different things at the same time, because I always want to try and give 100% to everything that it is that I'm doing. Okay, so something like that. And I know that you might think, isn't that a bit short of an answer if you're meant to take a little bit longer for the stations? But like I said, I just came up with this answer off the bat. But you guys can definitely try and have a think. You can think of some longer answers if you want. But also, sometimes in stations, they do ask more than one question. So, you also don't want to ramble on too much as well. But you can see point, proof, and progress. How am I getting better at it? I've showed those kind of key ideas very, very easily. Okay, so so that pretty much concludes all that I had for these personal insight and motivation questions. And so the idea behind these questions is, it's not about having the perfect life story. It's not about being an incredible person from the moment you were born until right now, and that's why you're the best doctor of all time. But it's about being honest with yourself, showing self-reflection, realistic motivation, and trying to create these links between the experiences that you've had and how you've progressed since then. Okay, and if you can try and use this framework, it can be really, really helpful, and it will allow you to sound structured, it will allow you to sound genuine and thoughtful in pretty much any station. But I like this 3P specifically here because it's asking about your own qualities, and everyone can improve, right? There is no person who's perfect. You can always get better. So that's something to think about. So maybe one of the things you can do to put this into practice is why don't you guys try and pick out two questions that do with personal motivation and insight. Let's say, why medicine, or what is your biggest weakness, whatever it might be. See if you can write a little draft using this framework and put it down in the comments below, and I will do my best to answer to them, and I will potentially see if I can try and critique them, or I'll tell you what I like about them. Okay, so thank you as always for watching, and please do let me know what you would like to see next. And the other thing as well I'd say is, remember, practice speaking out loud until it sounds natural. Okay, and if you do want any other follow-up videos with more answers, or if you want to do, I was thinking about potentially doing like a live, like going live, and maybe you guys could just put questions in the chat and I'd do my best to answer them. But let me know if you'd be interested in that. But otherwise, thank you so much for watching, and I'll see you guys in the next video.